COVID-19 pandemic has changed the world in ways we never imagined. Beyond the physical health risks, one of the most profound effects has been on our mental health. In this video, we'll explore how the pandemic has impacted people's minds and emotions, the challenges faced, and the ways individuals and communities have responded. Let's begin by understanding the scope of the issue and why mental health has become a central topic during these unprecedented times. Certainty became a daily reality for millions as the pandemic unfolded. People worried about their health, their jobs, and the future. This constant state of not knowing what would happen next led to increased anxiety and stress. Many found it difficult to plan ahead, and the unpredictability affected sleep, concentration, and overall well-being. The world felt less stable, and this collective uncertainty took a toll on mental health everywhere. Lockdowns and social distancing measures, while necessary for public health, left many people feeling isolated. Human beings are social creatures, and the sudden loss of face-to-face interactions led to a rise in loneliness. For some, especially those living alone or far from family, the sense of isolation was overwhelming. This lack of connection contributed to feelings of sadness, depression, and even hopelessness for many individuals. Economic impact of the pandemic was severe. Many lost their jobs or faced reduced hours, leading to financial insecurity. Even those who could work from home often struggled with new challenges, such as balancing work and family responsibilities in the same space. The pressure to adapt quickly, combined with worries about income, created a perfect storm for stress and anxiety. Financial concerns became a major source of mental strain. Fear of getting sick or seeing loved ones fall ill was a constant worry during the pandemic. News of rising case numbers and overwhelmed hospitals only heightened these fears. For people with pre-existing health conditions, the anxiety was even greater. This ongoing health anxiety made it difficult for many to relax, leading to chronic stress and, in some cases, panic attacks. Children and teenagers faced unique challenges during the pandemic. School closures disrupted routines, and remote learning was difficult for many. The lack of social interaction affected their emotional development, and some struggled with feelings of boredom, frustration, or sadness. Parents and teachers noticed changes in behavior, such as increased irritability or withdrawal. Supporting young people's mental health became a new priority for families and educators. Older adults and those with underlying health conditions were among the most vulnerable during the pandemic. Many experienced heightened fear and isolation, as they were advised to avoid contact with others. The loss of regular activities and visits from family or friends led to increased loneliness and, in some cases, depression. Community support and outreach became essential to help these groups cope with the emotional impact. Healthcare workers and other frontline staff faced immense pressure. Long hours, exposure to the virus, and witnessing suffering took a heavy emotional toll. Many reported symptoms of burnout, anxiety, and even post-traumatic stress. Despite their dedication, the mental health needs of these essential workers often went unmet, highlighting the importance of psychological support in crisis situations. Uncertainty and fear surrounding the pandemic led to a noticeable increase in anxiety disorders. People who had never experienced significant anxiety before found themselves struggling with constant worry, racing thoughts, and physical symptoms like headaches or stomachaches. For those with pre-existing anxiety, symptoms often worsened, making daily life even more challenging. Feelings of sadness and hopelessness became more common as the pandemic dragged on. The loss of normal routines, uncertainty about the future, and ongoing stress contributed to a rise in depression. Some people found it hard to find motivation or joy in activities they once enjoyed. Recognizing these signs and seeking help became more important than ever. For some, the stress and isolation of the pandemic led to increased use of alcohol or other substances as a way to cope. While this might provide temporary relief, it often creates new problems and can worsen mental health in the long run. Recognizing unhealthy coping mechanisms is a key step toward healthier ways of managing stress. Many people experienced grief during the pandemic, whether from losing loved ones to the virus or missing out on important life events. Funerals and other rituals were often postponed or held virtually, making it harder to process loss. This collective grief added another layer to the mental health challenges faced by communities worldwide. Sleep problems became more common as stress levels rose. Some people found it hard to fall asleep, while others woke up frequently during the night. Disrupted routines, increased screen time, and anxiety all contributed to poor sleep, which in turn affected mood and energy levels during the day. Constant exposure to news and social media updates about the pandemic contributed to information overload. While staying informed is important, too much negative news can increase anxiety and make it harder to focus on positive aspects of life. Many experts recommend setting boundaries around media consumption to protect mental health. Despite growing awareness, stigma around mental health issues remains a barrier for many people. Some hesitate to seek help out of fear of judgment or misunderstanding. The pandemic highlighted the need to break down these barriers and encourage open conversations about mental health, making support more accessible to everyone. With in-person services limited, telehealth and online therapy became essential tools for mental health care. Many people found it easier to access support from home, and therapists adapted quickly to new technologies. While not a perfect solution for everyone, these services helped bridge the gap and provided much-needed support during a difficult time. Communities around the world responded with creativity and compassion. Mutual aid groups, helplines, and online support networks sprang up to help those in need. These initiatives provided not only practical assistance but also a sense of connection and hope, reminding people that they were not alone in their struggles. Self-care became a buzzword during the pandemic as people looked for ways to manage stress and maintain well-being. Activities like exercise, meditation, and creative hobbies helped many cope with uncertainty. Establishing routines and setting aside time for relaxation proved valuable for mental health. For families, spending more time together brought both challenges and opportunities. Some experienced increased tension due to close quarters and stress, while others found new ways to bond and support each other. Open communication and shared activities helped many families navigate the ups and downs of pandemic life. Getting outside and staying active proved to be powerful tools for mental health. Even simple activities like walking or gardening helped reduce stress and boost mood. Nature offered a sense of calm and perspective, reminding people of the world beyond their immediate worries. Many people turned to creative pursuits during lockdowns, discovering or rediscovering hobbies like painting, music, or writing. These activities provided a sense of accomplishment and joy, offering a healthy distraction from stress and uncertainty. Creativity became a valuable outlet for emotional expression. Mindfulness practices like meditation and deep breathing gained popularity as tools for managing anxiety. These techniques help people stay present, reduce negative thinking, and find moments of peace amid chaos. Many found that even a few minutes of mindfulness each day made a noticeable difference in their mood. Maintaining healthy eating habits and getting enough sleep became more important than ever. Good nutrition supports brain health, while quality sleep helps regulate mood and energy. People who prioritized these basics often found it easier to cope with stress and maintain resilience. Technology played a crucial role in keeping people connected. Video calls, online games, and virtual events helped maintain relationships and combat loneliness. While not a perfect substitute for in-person contact, digital tools offered a lifeline for many during periods of isolation. Despite the hardships, many people discovered new strengths and resilience. Adapting to change, finding meaning in small moments, and supporting others helped individuals and communities grow. The pandemic highlighted the importance of flexibility and hope in overcoming adversity. The pandemic exposed and sometimes widened existing inequalities in mental health care. Not everyone had equal access to support or resources, and marginalized groups often faced greater challenges. Addressing these disparities is essential for building a healthier, more equitable future. Governments and organizations responded in various ways, from expanding mental health services to launching public awareness campaigns. While some efforts were successful, others revealed gaps in the system. The pandemic underscored the need for ongoing investment in mental health infrastructure and support. As the world moves forward, it's important to reflect on the lessons learned. The pandemic showed that mental health is just as important as physical health. Building supportive communities, reducing stigma, and investing in accessible care are key steps for the future. Recovery is possible both individually and collectively. With the right support, people can heal and even thrive after difficult times. The pandemic has sparked important conversations about mental health, and there is hope that these changes will lead to lasting improvements. The impact of the pandemic on mental health is complex and far-reaching. By understanding the challenges and embracing new ways to support ourselves and each other, we can build a more resilient and compassionate society. Thank you for joining us on this journey through the mental health effects of the pandemic. Remember, you are not alone and help is always available.